On a daily basis, healthcare workers are faced with considerable personal and professional challenges that can often lead to high turnover and burnout.
Healthcare workers have always faced a lot of challenges, but prior to the COVID pandemic, they faced challenges such as short staffing, lack of work-life balance, lack of recognition, and also not being able to have the time for professional and personal development. Everything compounds. Many times you give all you can give at work, and when you go home, you don't have any more left to give. That causes stress and anxiety. They may walk away and try and find, a different career.
With high workloads, stressors, and demands prior to the pandemic, COVID-19 placed an extraordinary amount of pressure on physicians and other healthcare professionals.
All of a sudden you had a virus that very little was known about, that was causing a lot of morbidity and mortality and was easily spread. First thing you thought about going into work was, how am I going to help minimize the spread of the virus? How am I going to treat any patients that I see? What am I going to do to keep the patients and keep the building safe? As well, all of a sudden we had a new product line, testing vaccines, monoclonal antibody treatments, and now with boosters, it involved getting into telemedicine, and none of us were really well versed in that. It was sort of like your airplane is getting ready to take off, but you're still building it.
I believe that the COVID pandemic has further exacerbated challenges in all of healthcare. Not just one department, but all departments. We do fire drills, we do hurricane drills, tornado drills. What we didn't do was a drill for a pandemic. We had to make it up as we went along. I think that's what everybody had to do. All of a sudden, all departments developed a shortage of equipment. So we had to reuse masks. That was the first time in my career as a nurse for 29 years that I have had to do that. And so that was a little scary. In addition to your daily workload, you had COVID testing lines. You had COVID vaccine lines, trying to put two jobs now into the job that you had. I think the biggest challenge that I think I would have to say is emotional stress. You may give patients bad news and upsetting news, but this was a daily thing.
During these unprecedented times, it has become increasingly more difficult for healthcare workers, with growing isolation, economic stress, and decreased access to community support.
When you make them aware that they are an important part of the process, then healthcare workers become owners of the processes, of the mission, of the vision of the corporation. It's just a win-win. They feel empowered, and the patients can sense that.
While many initiatives have been attempted in healthcare organizations throughout the years, little has achieved long-term success, furthering the need for a system that can sustain and grow a thriving organizational culture.
Corporate transcendence is a leadership blueprint that drives culture transformation and delivers excellence throughout every aspect of an organization. It values diversity, it thrives on equity, and delivers inclusion. It surrounds itself around people being the most valuable asset of any organization. Before the pandemic, we had a lot of issues and problems that we needed to address that were constantly recurring, and then post-pandemic, they seemed to escalate to a greater level. And for so many years, we have never put the focus on the healthcare worker. We needed to try something different. If you don't value yourself or feel valued, how can you value another individual? The more we put into them, the more we recharge them, the better they can deliver from leadership to the front line.
The blueprint establishes a 3-3-3-1 principle, where leaders and colleagues distribute their time between focusing on organizational culture, quality, financial sustainability, and governance.
30% of our time, we need to be focusing on people, whether it's our patients, our visitors, our guests. Then 30% of our time, we need to focus on quality. The product we deliver, the clinical outcomes of our patients are vital. I mean, that's why we signed up for healthcare, to help people have better quality of lives, to be there when they've been traumatized or need surgeries. 30% of our time we need to spend on finance. When we have resources, we can deliver the kind of healthcare that every patient deserves. And then, last but not least, is the governance, the accountability within the organization. If we do focus on the first three parts, the culture, quality, and finance, that governance will take care of itself.
This culture blueprint helps you to put culture first. Your employees are your top priority. If your employee is suffering from low morale, low self-esteem, not feeling rewarded and valued, they won't be able to take high-quality care of the patients. We pride ourselves on growing our own. We have had up to 30 internal promotions in one calendar year. This culture blueprint will definitely lead the way to make you a provider and an employer of choice. And by being that provider and employer of choice, you will be able to provide that excellent, safe patient care.
In addition to creating accountability for its stakeholders, transforming into an organization that becomes an employer and provider of choice can have excellent clinical care outcomes.
Having a thriving organizational culture, it drives your quality outcomes. So if you have happy employees, they provide great care, and the patients want to come here to get the great care.
In order to implement the developments of tomorrow, the healthcare community needs a culture system that values colleagues and instills in them a commitment for the future.
We find ourselves in healthcare at a crossroads. Never before has our front line been in the public eye more than the last few years. And now the public sees the tremendous work, stress, and issues that many times are inherent within our system. We're forced to put our work environment, our culture, first and priority. And we have to be innovative to do that. It has to be more than a pizza party. We have to learn how to grow and develop. We have to have that system in place, that we are always ensured that our excellence tomorrow is always greater than our excellence today.